Let's talk about therapeutic principles. Early treatment to prevent illness progression. The sure basis for treatment is a firm diagnosis established by means of the four diagnostic methods: symptom analysis and differential diagnosis. Without a firm diagnosis, the optimal results from treatment is not possible. The principles and techniques of diagnostics, symptom analysis, and differential analysis have been described. So today we shall be focusing more on the principles and common methods of therapeutics in Chinese medicine. There is a passage in the internal classic that compares the treatment of an illness to the governance of a nation. The key to governance of a nation lies in effective laws and institutions, and these laws and institutions are more effective if put in place before the occurrence of any disturbance than after. Similarly, therapeutics should emphasize prevention prior to the development of an illness. This is not always possible, but prevention is still applicable when illness has begun. In this context, prevention includes three concepts. When illness has begun, prevent complications. Secure unaffected regions to prevent progression or transmission of illness, and prevent complications during convalescence. Number one, when ill, prevent complications. Though the ideal is to prevent illness from developing at all, it is not possible for every person in every situation. However, it is of practical significance to maintain an optimistic outlook as well as to diagnose and treat early in order to prevent complications. Illnesses manifest traceable symptoms of development and progression. Making an early diagnosis requires the physician to observe the patient carefully and search thoroughly in order to formulate a firm diagnosis. For example, an exogenous illness generally proceeds from the exterior to the interior and from the superficial to the deep. Hence, when the illness is still in the exterior, the physician must seize upon the cold intolerance, fever, body aches, and other characteristic symptoms and promptly secure the exterior so that the pathogenic evil can be dissipated from the exterior and prevented from growing deeper. In the case of wind invasion, stroke, before the appearance of sudden syncope, wry mouth, hemiplegia, and other typical symptoms, the physician must seize upon the early symptoms of dizziness, faintness, and numbness of the limbs, and in optimistic anticipation, apply the therapeutic principle of calming the liver and extinguishing wind. By applying this principle, the physician can often prevent the illness from progressing into the meridians and viscera. Number two, secure regions not affected by illness. In accordance with the theory of the five elements, because of the relationships of generation and restraint, illnesses in a visceral organ will often transmit to another visceral organ. For example, the liver belongs to the wood element and the spleen belongs to the earth element. When movement of liver qi is impeded, the spleen and the stomach can become injured. In the early stages of impedance of liver qi, in addition to removing the blockage, a skilled physician will often apply herbal medicines that strengthen the spleen and the stomach to prevent their injury or insufficiency, thereby closing off the path of transmission for the liver illness. In the treatment of heat illnesses, it is often feasible to complement sweet cold herbs that nourish yin with salty cold herbs that augment yin in order to prevent heat from further injuring kidney yin, even after it has already injured stomach yin. In the treatment of an exogenous illness, in order to prevent the illness from transmitting from the exterior to the interior, it is possible by applying acupuncture to acupoints along the foot-yangming meridian to facilitate the movement of qi and blood. Doing so may prevent the exogenous evil in Taiyang from transmitting to the interior. These are examples of securing regions not yet affected by illness. Number three, during convalescence, prevent complications. During convalescence, genuine qi may not have recovered fully. Sometimes the treatment may not be sufficiently thorough in removing the pathogenic evils, allowing it to submerge in the body. If this is neglected or improperly managed, there may be recrudescence of the illness. The treatise on cold attack points out clearly that during convalescence, from an exogenous illness, the person must not overindulge in sexual activity in order to avoid reappearance of weakness, fever, dyspnea, nausea, or vomiting, which indicates re-injury of qi and blood. In general, after symptoms have subsided, the patient should continue to take medicines for a period of time, depending on the vigor or weakness of the constitution and the amount of residual pathogenic evil. Sometimes, when first recovering from a heat illness, the patient may show subsidence of fever and coldness in the body. At this stage, there often is residual heat. Using a warming herbal formula or a restorative at this time may reactivate the residual heat, much like the rekindling of fire from the ashes. Thank you for your attention.